Good morning.
Good morning.
Tell me what was going through your mind and what you were feeling as you were making those comments.
Yeah, thanks, Marcy, and thanks for inviting me onto the show. Um, I am the CEO of Keewatinohk and Minoayawin. I'm a family physician by training, and I'm an academic in terms of analyzing racism and how it's actually fostered within the healthcare system specific to First Nations people. I was feeling frustrated. Um, After all the work, about 30 years of work that I've been doing in various parts of the world, as well as various teams, to try and attack and eliminate First Nation specific racism within the healthcare system. And so, in my job around health transformation for First Nations people located in Northern Manitoba, I have to take deeper dives into the systems, including the bureaucracies, and look for ways to make changes fundamentally that actually drive and improve healthcare for First Nations. And so, what you heard was my frustration, as well as I'm a recognized medical educator. I have a master's degree in adult learning theory, and I use that across Canada, as well as previously at the University of Manitoba, and took on the task of trying to locate, understand, and eliminate racism as we teach new doctors. And so what you saw was a culmination of that. We, in the beginning, we said cultural safety and all that kind of stuff, but it has nothing to do with culture of First Nations people. First Nations people are just human beings, right? But they're not treated as human beings. But so we came up with the word and adopted the word racism, which was, I think, generally born kind of in the United States with a Black experience, etc. And so that's really what goes on, is that we're trying to foster good care, respectful care for First Nations, but it's not working.
So let me get right to the heart of this then.
Yeah.
If education doesn't work, and if it's time to speak more plainly about what is happening here, and if we do have hatred at the root of this, and education's not combating against that, it's not about awareness, it's just hatred for hatred's sake, or racism for...
Totally.
Where do we go from here to improve things for people who are trying to access healthcare? Indigenous people within our system.
Yeah. And I just want to make one comment about that so that people understand. If you are a First Nations person and you look like a First Nations person, whatever that might be, by the system, or if you have a card that identifies your treaty status of your treaty, you are at risk going into any healthcare system within Manitoba. There's a risk that you will not be treated correctly, you will not be listened to, you will not be offered the diagnostics, nor will you be offered treatment or follow-up. That's not all cases. Let me make that clear. But there is a risk for anybody who's First Nations in Manitoba to go to any healthcare system in Manitoba. I'm talking about the hospitals, the secondary and tertiary hospitals. That is a fact. Some of the solutions that we're working on for northern communities, 23 sovereign communities that we work with, is we're looking to take over the healthcare system. We're looking to be drivers of the healthcare system. We want the resources because we can do better. Okay, there's no doubt about that. That doesn't mean that we wouldn't hire white and all other doctors.
But it's First Nations-led care by First Nations-led healthcare professionals to First Nations Manitobans.
Yeah, and that would include non-Indigenous people. There's no doubt about that. Not everybody acts on the hatred that they might feel towards First Nations people, but we need our own system that could run parallel, can actually help change systems and improve even care for white people in this province.
As you move toward bigger goals that you're talking about, obviously, how in the meantime what would you say to people listening about how they advocate within the system that we have?
Well, I tell everybody, I'm talking to non-Indigenous people as well, know your rights when you go see a provider. Know your rights and demand your rights. but be very careful. One of the common features for First Nations people when they actually advocate, they're termed angry. And they're generally a security guard will be called and they'll be kicked out. That is a common feature. So be careful for non-Indigenous people as well. Sometimes when you advocate, the system is not prepared to listen to your concerns and to take your concerns seriously. Sometimes you could be thrown out. And we have to develop systems. And the minister knows this, the Minister of Health knows this. We have to develop systems that are responsive immediately to the concerns of a patient, all patients. And I don't think we do that very well here at all. Not yet.
I know that you spoke to our producer about something called hopeforwellness.ca. You've been doing some work with Keewatinohk, Inniniw, Minoayawin, Inc. Can you tell us a little bit more about what that is?
Say the question again. Sorry, Mark.
The hopeforwellness.ca is something you've been working on. Can you tell us a little bit more about what that work is?
Hope for Wellness.
Yes. I apologize. My producer gave me this as a prompt question, but perhaps something's gone astray here. Why don't I just ask you?
Yeah, no. That's okay.
So why don't I just ask you straight ahead? What are you working on? Any projects right now that you find have been helpful in the system in terms of either helping First Nations patients advocate for themselves, or if they face discrimination to push back?
Sure, absolutely.
What kind of projects are you working on?
Yeah, so we're working with the College of Physicians and Surgeons of Manitoba to examine racism in practice and examine how we actually support physicians for change in their behaviors towards First Nations people. That's one thing. But also we work with the regional health authorities, particularly the Northern Regional Health Authority, and we look at crafting clinical encounters that actually meet the standards and needs of practice for everybody, including and specifically for First Nations people. We also work a lot in devising what's called surge teams in response to, for example, the epidemic of syphilis in communities and HIV. We've crafted teams that differ from the province and the feds in terms of looking at using new technologies and providing care. So we're doing a number of things like that, and including looking at a van that we have in Northern Manitoba in Thompson that is staffed by nurses and other people who actually support and help people who are forced to live on the streets in Thompson. It's a new piece of healthcare that we're doing, and we do that in concert with all other provider systems in Thompson. And it's quite successful to date to provide that type of care that generally was not provided in a robust or a racism-free environment for people in living in Northern Manitoba.
Appreciate having you with us, Dr. Lavallee. Much to talk about. Thank you very much.
Thank you. Have a good day.
You as well.